If you find yourself like this person here driving a friend or a loved one to appointments, or if you're helping them manage their finances, maybe even paying a few bills of theirs yourself, or maybe you're helping them figure out on a daily basis their meds or their meals, or you do chores for them. Well, if any of those things, then you know what? You're a caregiver. It could be an everyday responsibility or just a once a week thing. Either way, the United Way of North Carolina wants to help you with their 211 hotline.
When someone calls 211 and identifies themselves as a caregiver, our team knows, a little bit more about what kind of resources they may need. Perhaps they need meals delivered a couple days a week to the person that they care for, so that then they can go and be free to do other things. Maybe they need a support group. Maybe they need to learn some other skills around caregiving. Maybe they need, a group that has information on Alzheimer's or dementia to help them understand how to interact with their loved ones.
This new feature of 211 is free and available to anyone in North Carolina. You can call any time of day and any day of the week. The added feature is thanks to a partnership with AARP. Along with the resources they can point you to, the NC 211 navigators are also trained to help the caregiver personally.
So our navigators are in a position and have the time and the space available to just make calls and just say, hey, I'm just calling to check on you today and see how you're feeling, how your stress level is, and if there's anything that you need.
Caregivers, you can call 211. They're now trained to help you, but really 211 has resources for all of us, from consumer services, healthcare, community help for a variety of things.
So you just heard Tanya share the ins and outs of the 211 hotline, but we are going in depth today because it is one of the best resources in our community. We're joined by Heather Black with the United Way of North Carolina. She's going to answer all your questions you may have about the 211 hotline for caregivers and more. Let's start with the basic of where you can send in your questions. Text us 336-379-5775. So Heather, how do we have this 211 hotline? Who runs it?
Great. That's a great question. So 211 is brought to you by United Way of North Carolina, and also with the support of all your local United Ways around the state of North Carolina. So locally here, United Way of Greater Greensboro, United Way of Greater High Point, all help make sure that 211 is there as a vibrant resource in our community. We also have support from the state of North Carolina through the state budget. So we're very grateful for all of our partners.
When I first moved to North Carolina almost a decade ago, I was blown away that we had this resource because not everywhere is that lucky. What is the reason that someone should call 211?
So 211 is there really for everyone. We have a huge database of resources around health and human services. So things like food, rent assistance, utility assistance. We also have resources around mental health resources, special resources for folks who are dealing with issues, maybe an aging parent, how to navigate childcare, things like that. So really, we are there to help you navigate the system. Sometimes it can be overwhelming when you're trying to solve a problem that's related to health and human services, to find the right agency to help you. And that's what we're there for, is to help you kind of figure out who that next call should be to.
Are there certain hours that 211 is open?
So 211's there all the time. We are 24/7, 365. So this time of year is especially interesting for us as we work to make sure that we always have staff available, but it is a live call specialist who will answer your call, folks here in North Carolina, and they are there 24/7 every day of the week.
What is the most typical call you get? What's the biggest question people have?
Well, the highest need that we usually are hearing about right now is around housing and utility assistance. I think there's still so many folks who are recovering from the pandemic, the economic impact of the pandemic. So there's still a lot of folks recovering from that and just needing help kind of, catching up from the financial impact. But I will just say that there's really no such thing as a typical 211 call. That's what's so unique about the role of a 211 call specialist, is that every call is a little bit different. And that's why they go through a lot of training to be able to answer all those calls and to help our fellow North Carolinians navigate sometimes some hard parts of life. But that's what they're there for. They are trained to help you do that.
So 211's not necessarily providing the help, but you're linking people up with where they can get help.
Exactly. We are not the direct service provider, but what we are going to do is have as much information as we can so that you can be prepared and ready to take that next step. We're going to tell you the best agency in your community. We're going to tell you their eligibility information, where they're located, what their hours are, what their application process is, as much information as we can. We have a whole separate team of people whose entire job is to always be updating and verifying that resource information so that we have the best information possible for you.
It's definitely a good resource. If you ever feel hopeless about something, give them a call. They have very smart over there and know how to work the system to help you find some solutions.
Yeah, exactly. Get through that maze of information.
So we're going to keep taking your questions about this on the other side of the break. What you want to know about 211.